So listen to this. 1/3 of pregnancy-related deaths occur after giving birth. This is according to a fresh new study out of JAMA Network Open. Researchers found that 30% of maternal deaths were women who were 6 weeks to 1 year post-birth. They also found a stark racial and regional disparity in the numbers. Joining me now to break down the study's findings is Dr. Angela Bianco. She's a board-certified maternal-fetal medicine specialist. Good morning to you, Doctor. Thanks for joining us. Help us understand this study and why so many new mothers are dying after giving birth.
Well, good morning to you. This study is a large study with pretty robust data that corroborates what we've seen previously. And that is really the fact that the gaps in healthcare continue to widen across the US. The study identified that the maternal mortality and pregnancy related death rate increased by almost 30% from 2018 to 2022. And there does seem to be differences when you look at state to state data, as well as differences, as you mentioned, based on race and ethnicity. It seems that non-Hispanic Black women and women of American Indian or Native Alaskan descent are at greatest risk. They did identify the most common causes of death being related to cardiovascular underlying conditions, cancer, mental health disorders, endocrine disorders such as diabetes, and and this also corroborates data that's previously been reported. But I do want to point out a couple of limitations of this study. So the study could theoretically be criticized because it's based on death rate certificate data and retrospective data that can be inaccurate, especially when reporting on race and ethnicity. But one important point, actually, that the authors don't discuss in this publication is that this study is really only based on live birth rate data, and it doesn't even include stillbirth data.
Hmm.
And we know that the risks associated with stillbirth are even higher for moms.
Wow.
Oftentimes, stillbirth can be related to maternal death. So the rates that we're seeing in this publication are likely lower than what is experienced in reality.
That's eye-opening to hear you note that. According to the CDC, though, most pregnancy-related deaths are preventable. So for people watching this and alarmed by what the study found, how can women stay safe?
Well, it's really important that we focus on women after pregnancy, not only during pregnancy. Many women have underlying conditions unmasked due to the physiologic stressors of pregnancy, and then they're lost to follow up. So we're trying to really pivot here and have a paradigm shift in how we care for women and not just do a quick 6-week postpartum checkup, but link women to appropriate ongoing care, whether that's with an internist, a cardiovascular specialist like a cardiologist after pregnancy. And our American College of OBGYN now suggests that women are assessed up to 3 weeks, not waiting for that 6-week postpartum checkup, and then having a comprehensive assessment at 12 weeks. And as I mentioned, ongoing care during the subsequent months after delivery.
Yeah, really important reminders. We encourage our viewers to take a look at this study. Dr. Angela Bianco, thanks so much.